There's been a lot of enthusiasm for offering patients with muscle-invasive bladder cancer, chemotherapy prior to their surgery. And the reason for that is there's really the surgery that we do for bladder cancer still has significant limitations. Up to 20–30% of patients are destined to recur, and the field has been trying to move the needle on improving care for these patients. There was a SWOG trial that randomized patients to neoadjuvant chemotherapy versus then followed by surgery versus surgery alone, and that showed, a small but a statistically significant risk reduction in bladder cancer-specific mortality and overall mortality. Now, many centers, like our center, have really been very enthusiastic about offering our patients neoadjuvant chemotherapy. And what this abstract shows is that, at least within limitations of retrospective data, we really don't see any significant harm in giving patients chemotherapy before bladder cancer surgery. That's important. Our center had a manuscript spearheaded by Elizabeth Plimack, who's a medical oncologist at Fox Chase Cancer Center. This was a manuscript in Journal of Clinical Oncology. This manuscript demonstrated that a very novel way to give MVAC chemotherapy in a dose-dense fashion really was very safe. And what's important is what we tell our patients is that really largely almost everybody makes it to surgery within 3 months when they receive chemotherapy in this fashion. And we believe this is a significant sort of advance in the way to deliver chemotherapy to these complex patients.